Scoliosis. How to avoid surgery. Scoliosis is a curvature of the spine that, if not corrected in time, can be very painful and sometimes can lead to surgery. It is a deformation in the spine that begins with an asymmetry in the area of the sacrum, and over time generates a curvature that goes to the lumbar or dorsal area. On one side of the spine, the curvature is characterized by the presence of strong spasms in the paravertebral muscles, and on the other side, very weak muscles are found. How can you cure scoliosis? Normally, it is very difficult to correct this condition, since the spasms it causes are deep in the spine, and it is practically impossible to reach this area. The correction of the sacrum is also a complicated task that sometimes is difficult even for specialists. In this video, we tell you about some accessible and effective options to alleviate and correct scoliosis. Self-gravitation method. Integral therapy using CORDUS and sacrum devices. Designed by Russian doctors to relax the deeper paravertebral muscles and the alignment of the spine. CORDUS has 3 different sides for each area of the spine: cervical, dorsal coccyx, and lumbar sacrum. It is placed on a flat surface so that the user lies on it, and the axis of the spine is located between its tips. Because of the own weight of the body, constant pressure is made, and when breathing, the tips of the device penetrate to the deepest muscles of the vertebral system. CORDUS works in a symmetric, deep, and precisely way the intervertebral zone. After the first 3 or 4 minutes of pressure, these muscles relax. With an anatomical and innovative design, CORDUS fits between the vertebrae, separating them slightly and increasing the space between each of them, helping to restore their mobility. The oppressed nerves are released and the tissues of the intervertebral discs recover their good blood circulation, receiving the necessary nutrients for recovering. Eliminates muscle tension on one side of the spine and recover muscle tone from the other side in such a way that it balances the muscular tone on both sides of the curvature. Recovering the innervation symmetry, facilitating the repositioning of the vertebrae to its original position, and the decrease or deduct of the curve. And it is very important as part of the integral therapy to eliminate the asymmetry of the sacrum area, which is the area of origin of the condition. This correction is made through the sacrum device. Another important part of the integral CORDUS and sacrum method are the exercises to recover muscle tone.
It feels the change indeed. It feels a freedom of movement. It improves the mobility and position of the spine.
We have started to use CORDUS and sacrum, and truth is that since the first day we've seen changes in our patients, in their symmetry and their posture. We keep using it because we've liked the results we've had.
I like to start the therapies of these patients with scoliosis using the sacrum device, to start correcting the deformities. Once we have managed to reduce scoliosis from the 4th degree to a scoliosis of the 3rd degree. From then on, we would also start working with CORDUS, in order to correct and align the spine. It is very effective in treating scoliosis, and its symptoms. I suffered from scoliosis for many years. Now I am 33 years old, and I've had it since I was 18 or 19 years old. I started using CORDUS, and from the 2nd month on, I began to feel that the symptoms were beginning to disappear. To date, I have been using it for about 6 months, and practically the symptoms have completely disappeared. I was very surprised by its benefits. I liked it very much. Especially the feeling of how the spine is repositioning itself. I already have approximately 2 years using both devices CORDUS and sacrum with my patients, and I have been able to verify its excellent results when used to treat cervical pain, postural problems, low back pain and other chronic diseases of the spine. Since the first time I used it, I felt how it worked in my back. The tension and pain that I had been suffering reduced a lot.
Many problems that I have, especially scoliosis, have improved a lot. I feel more relaxed and the muscular contracture has reduced.
In patients with spine deviations, CORDUS helps them to recover much faster.
My pain's relieved. I feel very good. I feel relaxed and calm. I stand more upright. After using it, I felt very good. Very relaxed. My stress decreased. It improved the position of my spine. I feel very good. There is a change in my back, and I would even say in my posture.
It is important that even if you apply it in the practice, and correct the problems, and help the patient to maintain an adequate posture, the patient must perform the therapy and exercises with CORDUS and sacrum at home, at least 2 or 3 times a week, in order to achieve the desired therapeutic effect.
I came because I suffer from lumbar scoliosis and sciatica pain. I've had improvements using the device. And now I have less pain. I have type 1 diabetes and scoliosis. And after the session I felt much better. The pains decreased.
I suffer from scoliosis and sciatica. And I must say that I feel notoriously better from the pains I had. I was very pleased. I sincerely recommend it.
I suffer from scoliosis, and I have tried several therapies and none has helped me. I tried this device and the truth is that I felt really good. Thank you very much, CORDUS.
I feel much more comfortable. I congratulate this technology, so simple and so humane at the same time. I have seen a significant progress. We recommend it to the general public. It's very easy to use and it heals the pain. Very helpful, can be very effective, and I personally use it a lot.
I think it's an excellent device. My experience with CORDUS has been satisfactory.
For myself and with patients, obtaining very good results.
I think it's phenomenal. I felt it very comfortable. I really like the stretching feeling. I felt very relaxed. It looks very simple, but it truly is very effective. I think it will be very helpful. I feel very relaxed and comfortable.
They are very important tools that will be a great therapeutic support. CORDUS has helped me with my back.
I recommend the use of this device to other colleagues.
The athletes I treat have had really good results. I used it on myself, and I personally find it very useful. I have very good results with patients and with myself. This is a very interesting ally that will complement the work we do.
It is very good. I think it's fabulous.
It has benefits, it helps. I felt a lot of improvement. We're very impressed with the product. It's highly recommended.
This is truly impressive.
I've tried this device and it works wonderfully.
It's very effective. I feel good. The results are really excellent.
By using it frequently I will have good progress. It totally relaxed me. I was able to relax very well.
I was able to see the changes since the first application. I use it at least 2 times a week. It works a lot, it relaxes a lot.
I just tried the device. And the first impression that I have is that it's good. I feel much better.
I find the method very interesting.
This device is truly sensational. This device is fantastic and I recommend it.
This device worked really well for me.
I can see that it works. And it'll help me a lot.
I did have a bit of progress and I hope to get better results. It seemed to me this is a very good device. I felt improvement after the session.
I felt really good, and I'm having good improvement.
I feel more relaxed. I believe this will help me and my patients.
It was very adequate for me. It works. I was amazed by the results that the use of this device gives. I highly recommend it.
After the therapy I'm much better and I'm quite relaxed.
It really works. It's very practical.
It was excellent.
It's a device that works. I have used CORDUS, and it gives excellent results. I have tried the benefits of this device. It's something so simple but it really gave me good results.
I recommend this. They are excellent devices.
I tried the device and I really felt a lot of improvement. It's very comfortable. I started using CORDUS on myself. I had very good results.
CORDUS and sacrum are excellent tools for everyday use.
I felt my posture improved a lot.
The pain reduced a lot. I think this is a sensational thing.
I had a very significant improvement. It does work. You can feel the relaxation. Very practical.
I have used CORDUS and it has worked a lot. I liked it. The way I felt.
CORDUS is a very good device for relaxing the back and to align it. Sacrum is very interesting.
I feel very relaxed and happy with both devices.
I feel very good. I recommend it. It will be an extraordinary tool for me in my work of chiropractic.
I liked it very much. I felt very good.
It gives excellent results.
This goes straight to the point. I highly recommend it. I relaxed a lot. After the therapy I felt very good.
I have proved that this device works at cervical, lumbar and dorsal level.
This little device is definitely effective. I felt my back very relaxed. It's a wonderful device. I recommend it for everyone.
I feel good, I got relaxed, I want to use it to help people.
I feel very, very relaxed.
I liked it a lot and I recommend it.
I think it's good. We have seen that the body completely relaxes. I've been trying it on many people and on myself. It's super effective on certain back pains and also on neck pains. It helped me a lot to free the contracture.
In less than a month it completely released the tension that I had.
Although I am a yoga teacher and I know what to work, I recommend this device because it goes straight to the spot. I recommend it.
After the sessions, I can feel a flow of energy through my entire spine. Freshness. The pains I was having disappeared. I highly recommend it as an auto therapy.
I liked a lot the way it works. It relaxes a lot and it reaches a very deep level. And it does not move. I have tried this product during the last month because of a series of injuries on my spine. And it has worked wonderfully for me. We've used it during many classes. And on me, particularly, it worked on a contracture I had at cervical level.